All right, here are our daily stats for our coronavirus update. All numbers are locked into place by 5:30 a.m. Central Time. So these are all as of 5:30 this morning. Total confirmed cases, 89,842. That's up about 6,000 from Friday. Total confirmed dead up 255 from Friday. 18% of all active cases is steady, considered serious, meaning hospitalization. 5% of those require ICU treatment. That number is steady at 18%. The U.S. now has 88 confirmed cases and 2 deaths, both in Washington state. The CDC website is now showing 472 total citizens have been tested, up from 445 last Friday. Now, you're going to start to see the number of those infected in the United States go up. And here's why. Because we're now testing for them. Remember, the CDC website showing 472 total citizens have been tested in the United States. 472 people. I believe that coronavirus has been around here for a while, but because our healthcare system is good, because we're not freaking out about it, it's being treated like the regular flu. As these tests now become more and more frequent, because today there are 54 labs now having testing capabilities here in the U.S., the CDC has certified 12 regional hospitals to perform their own direct testings as of this week. That's new. So now, if you're going to one of these big regional hospitals, you're going to get the testing done right away. And more hospitals are going to come online. That means you're going to find more and more people. For instance, we now have a fatality rate in the U.S. of 2.5%. Well, that's really high. But that's because we think there are only 472 tests that have been done. So when you have 472 tests, how many of those have been confirmed and 2 people die? Well, how many people in the United States actually have it right now? I think you're going to see these numbers go through the roof.
Yeah, I mean, because they think it's been just being passed around, for example, Washington State, for weeks and weeks undetected.
Yes.
And
well, that should tell you it's not so bad here.
Right. And you know, like a lot of people they think are having, they may be passing it without even getting sick at all, showing no symptoms whatsoever, even after the incubation period is over. So, I mean, that being said, there's, in my opinion, no way this thing winds up anywhere near 2.5 or 2.3% fatality rate when this is over. I'll be stunned if it's above 1. But that being said, it's still a lot. I mean, when we talk about the flu itself, it's 0.1% die, but when 30 million people get it every year, that number is a big number.
So let me give you the stats. This is comparing the seasonal flu to COVID-19. And this is why governments are freaking out or taking aggressive action. This is versus the flu. The case fatality rate is currently 2.3% globally. In the United States, it's 2.5. But I don't believe that number because I don't think we know how many people have it. All right, so the fatality rate is 2.3 globally. The serious complication rate, meaning pneumonia and hospitalization. The common seasonal flu is 0.9%. This is at 18%. So 18% get pneumonia or have to go to the hospital. This is why it's so deadly for people who are older. Requiring an ICU, the common everyday flu is 0.25%. This is 5%. The rate of infection is 1.3. The rate of infection, or the R0 score, which they give, smallpox, I think, is like a 15, meaning it's very, very viral and spreadable. This is at 4.7. That's a lot. Time that it survives on surfaces, the flu is 4 to 5 hours. COVID-19 is 5 to 9 days. The incubation period, 2 to 3 days for the flu, 5 to 14 days for COVID-19. Natural herd immunity, which is really important. The common flu has that. So in other words, we all kind of we're all a little bit immune to it, and the different strains might hurt us, etc. We don't have immunity towards this. The hospitalization per 1 million infections for the seasonal flu, it's 9,000. For COVID-19, it's 180,000 per million. ICUs per 1 million infections, 2,500 for the seasonal flu, 50,000 for COVID-19. And fatalities per 1 million infections, 1,000 for the seasonal flu, 23,000 for COVID-19 as it stands today. But again, I think that number will come down.
And this is why, of course, you of course prepare for the worst case scenario that this rate sort of continues. It means adding lots and lots of tests. It means all sorts of different things. So you should prepare to be, incredibly serious. I think rationally understand that it's not going to be as high as this, thankfully.
Yeah. We're going to be inconvenienced. And let me just say this. I've been explaining it for the last few days to people like this, and they seem to connect with it. First, they freak out, and they think I'm saying to them, we're all going to die. I'm not saying that. Listen to me carefully. We're all going to get this. All of us. We're all going to get COVID-19. Whether it's this month, next month, this year, next year, 5 years from now, we're all getting it.
Just like we all will get the flu.
Exactly right. The flu, the pandemic of 1918, we are still passing around. The seasonal flu is part of that flu, the original flu from 1918. So we've all had the same flu of 1918. We've all had it several times. Okay?
It's incredible.
It's incredible.
Yeah.
That virus was introduced in 1918. It was a pandemic. Well, we've all had it, and we didn't die. The same is true. This will be around most likely for the rest of our lives. COVID-19 is going to be added as a secondary flu now. So you'll get this flu, the seasonal flu of 1918, the Spanish flu, and you might get COVID-19. So there'll be 2 strains of flu. Now, if it's exactly the same as the flu, that just means we've doubled the amount of deaths every year. 65,000 people died last year for the common seasonal flu.
And while we've been talking about COVID-19, 18,000 have died this year.
You're right.
From it.
So more people are dying from the seasonal flu than most likely will die from this flu. Okay. But it's very viral and as far as spreadable. And if it mutates and we don't have any defense against it, it could be bad.
It's just the unknowns, plus no
Correct.
treatments.
But stop thinking that I can't get it. I can't get it. I can't get it. You might already have it, and you might get it. And if it's this month, okay, that's probably going to be scary. But in time, we're all going to get it. We're all going to get it, and the world's not going to end.